So now coming to intestinal obstruction. In newborn, the most common is duodenal atresia. What is this barium appearance of duodenum atresia?
Double bubble.
Very good. Double bubble sign. Very good. Double bubble sign. In children, the most common is intersusception. What is intersusception?
Overlapping of segments.
It is overlapping, or better term is telescoping. See, suppose this is one bowl and this is one bowl. What happens is the one part of bowl goes into the other part of bowl and forms obstruction. This is telescoping. Okay. This is the most common cause in children. In adults,
Adhesions.
Okay, small bowel adhesions. In large bowel obstruction, if they ask specifically about large bowel, it is malignancy. So remember these four: children, newborn, adults in large bowel, adults in large bowel. What is that?
Cancer.
Cancer. And what are the four cardinal features of obstruction? See, this is the bowel. There is obstruction here. Nothing is going down. So what are the four cardinal features?
Constipation.
Sorry?
Abdominal pain. Constipation.
Vomiting.
Pain. Vomiting.
Constipation.
Regurgitation.
Constipation or something else? Partly correct. Obstipation.
Oh.
What is obstipation? What is constipation basically? Constipation is not passing solid fecal material. Obstipation is both solid flatus and feces. Constipation, he will be able to pass flatus. Okay, he is not passing feces, he is passing flatus in constipation. Obstipation, he is not passing both. Okay? Yes, no?
Yes, sir.
Okay, sir.
Okay, pain is there, vomiting is there, obstipation is there. What is the other fourth point? In obstruction, what is there? He is vomiting, everything is going outside, nothing is going from below, everything is vomiting, he is having severe pain. Fourth point?
Maybe.
Infection.
Distension.
Abdomen distension will be there. Okay, see, this is intersusception. Intersusception, one part goes into the other part. This is intersusception. Okay, it is seen between 6 months to 6 years. Most common cause is rhinovirus infection. Okay, rhinovirus is what? Rhinovirus is our common cold. Okay, so the most common type of intersusception is ileocolic. That is, ileum goes into the colon. In old, it is colocolic. In children, it is ileocolic. In old, it is colocolic. Remember this. These two are important MCQs. So, most common point of intersusception is ileocolic in children. In old, it is colocolic. Okay. And the clinical features are: the patient will pass red currant jelly stool. Red currant jelly stool. Where do you see Anchovisaspus? Anchovisaspus. Good.
Amoebiasis, enrobius.
Yeah. Here you will see red currant jelly stool. Red currant jelly stool. Remember, this is Anchovisaspus. This is red currant jelly stool. It is in intersusception. 1. The patient will have vomiting. Okay. And there will be a sausage shaped mass here. A sausage shaped. If you feel, it is a sausage shaped mass. Okay. And the right iliac fossa is empty. Everything is moved up. So the empty right iliac fossa is seen. Empty right iliac fossa. It is known as lead dance sign. Empty right iliac fossa and a sausage shaped mass in the upper abdomen. Where did you find olive shaped mass today? Olive shaped mass.
It was in congenital atresia.
Congenital hypertrophic pyloric stenosis.
Pyloric
Congenital
stenosis,
hypertrophic
right.
pyloric stenosis, you find that olive shaped mass. Here you can find this sausage shaped mass. Okay. So this is important just for your sake. Once again, ileos, which is the most common intersusception? Which is the most common type of intersusception?
Ileocolic.
Ileocolic.
Ileocolic
in children and colocolic.
Okay. So this is the colon, this is the ileum, isn't it? So what happens is this colon will be like this and the ileum will go into the colon. Okay. So here it will be empty. If you palpate the right iliac fossa, it is empty. Empty right iliac fossa. It is known as lead dance sign. And there will be a mass here. This mass will be like, how is this mass in the above?
Sausage.
Mass. Okay, so remember these two things. And ultrasound, you can see this target sign or pseudo kidney sign or bullseye sign. These are the signs in ultrasound. Target sign, pseudo target sign. You will hit the target, right? Target sign. This is the target. And pseudo kidney or bullseye sign. But these are not important for us. What is important is this one. See, on barium enema, we find this class sign. See here. Are you able to appreciate it? Yes, no?
Yes.
Yes, sir.
So this is very, 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 very important. Like just like a bird's beak, this may be asked also. So just remember, class sign is seen in intersusception. Class sign, intersusception. And coiled spring sign. Coiled spring sign. This is also seen in intersusception. Coiled spring here, sorry. Coiled spring sign is seen in intersusception. Class sign is seen in intersusception. Coiled spring sign is seen in intersusception. Okay? Just management, nothing in infants. You give air enema. Give enema from air enema so that it will come outside. One bowel loop has gone inside. So just it will come outside. If surgical reduction.
Hydrostatic enema.
Yeah, hydrostatic, air, saline, whatever. You just reduce it. If it is not, then do a surgery and just milk it off. Okay. So meconium ileus is normal rotation. Yeah. See here, what is this X-ray classically? It is having multiple.
Pattern.
Sorry.
Tram track.
Tram track. Okay. Multiple. The other answer I want. Multiple
Multiple gas shadow.
Yeah, multiple air and
Obstruction
fluid
of
levels.
small-
Air fluid levels. See here. See this one. This is air. This is fluid. Air fluid. Air fluid. Air fluid. Air fluid. Air fluid. Okay. If there are more than 5, then it is suggestive of intestinal obstruction. Just remember this. Multiple air fluid levels. If there is more than 5, step ladder pattern. No gas in the this we can't see, but these two we can see. There is step ladder pattern also. Okay. So this is, what is this X-ray of? This X-ray belongs to come on. Intestinal
bowel
obstruction.
obstruction.
Intestinal obstruction. And we'll close with this picture. What is this? It is written here, volvulus. But what is volvulus?
Bean appearance.
Which appearance?
It's like a
Coffee bean.
Coffee bean appearance.
rotation.
Yes, coffee bean appearance. Okay. So this is the coffee bean appearance. Okay. So there is still some fistula, fissure, hemorrhoids are left. Yeah, okay, we'll complete it if time is there. Otherwise, it's okay. These are not so important also. Fissura, fistula, fissure, and hemorrhoids. Okay. So before we complete, today's the most important points are class sign. Where is it seen? Class sign.
Intersusception.
Common type of intersusception.
Ileocolic in child.
Ileocolon.
Colocolic in adult. Old.
Ileocolic. Transmural involvement is seen in
Disease. Crohn's disease.
Crohn's.
this is okay. Air under diaphragm is seen in air under diaphragm. In an X-ray, if you see air under, not only air under
Perforation.
perforation, not only that, you have to recollect the image also. Okay, the left side, the right side, if there is air under diaphragm, that is
Perforation.
perforation. If it is on the right side, if it is on the
Fundic gas.
if it is only on the left side, then it is If it is only on the left side, then it is
Perforation.
right side, it is perforation. Left side. Somebody was telling left side. Fundic gas shadow. Okay. And multiple air fluid levels are there. Multiple air fluid levels. Intestinal obstruction. Step ladder pattern and multiple air. See this image. You will never forget. Classical image. Okay. So the question they will ask you like this: a 45-year-old male person, a male patient came to your OPD with constipation or with obstipation, vomiting, and abdominal distension. X-ray abdomen was done, which was showing this finding, and they will show the finding to you. So then you have to identify whether it is a perforation or whether it is obstruction. So don't just think they will just give images only. Okay. Along with image, they will test your clinical knowledge also. Okay. So if you can just identify with this, it is very good. You can just, if you know what are the 4 cardinal features of obstruction? What are the 4 cardinal features of obstruction?
Distension,
obstruction, obstipation.
Obstipation, vomiting, abdominal distension, abdominal pain. So on seeing that question only, you get some idea. Okay, you get some idea. These 4 things are there, so it is obstipation. It is intestinal obstruction. And once you see the X-ray, this also you know. You are double sure that this is intestinal obstruction. Got my point?
Got it,
Yes,
sir.
sir.
Yeah.
Yes,
So
sir.
always image also is important, and the concept behind it is important. Just remembering class sign is okay. You can tell by seeing class sign, it's okay. But also the intersusception, red current jelly stool. If they give you a red current jelly stool, what you will mark? Intersusception. Okay. Okay then. So almost we completed GAT. Most of them is completed. So tomorrow we will complete.
Sir, can you? Sorry, sir. Can you please show the coffee bean sign?
Yeah. I'll just take all this out.
It's all right, sir. I got it. Thank you.
Okay.
Okay, sir.
Yeah. So tomorrow we'll do hepatopancreatic system, trauma, and hernia, bowel transfusion, and shock. These are the topics which are left for us. Okay.
So we don't have to read about hemorrhoids, fistula, fissures, and all the left out.
Yeah, you have to read about it. We'll see if time is the tomorrow. I don't think time will be there because there are also big topics. Or I'll ask for a session once. We
What
will do
about
like
trauma,
that.
sir?
Sorry.
Trauma.
Yeah. First hepatopancreatic trauma, then blood transfusion, shock, and hernia.
Okay, sir.
4 topics for tomorrow also.
Yeah, 4 topics. But don't worry, blood transfusion, shock is little small topics only. Trauma also, most of them will be interesting only. It will be, we can do it fast. Hepatopancreatic is large thing. Okay. So that means
I shared a screenshot with you of a question which was there in FMG June.
Okay.
Could we
That is-
discuss that quickly, please?
so where is it getting open? Are you able to see the image?
Yeah, we are.
Okay.
I can.
A 54-year-old female presented with history of low-grade fever, weight loss for the last 6 months. The image of barium study is shown below. What is the probable diagnosis? What do you think it is? So what do you think it is? I'll tell it before that. What do you think it is?
I know the answer
Carcinoma
now.
colon.
No,
And
Carcinoma
it's
colon.
ileocecal
it is ileocecal
tuberculosis.
tuberculosis. See, in the
Yes.
question only, it is that just now we discussed. Low grade fever, weight loss for 6 months. So what is that? Low grade fever is there and weight loss is there for
So
almost 6 months.
tuberculosis, basically.
Tuberculosis.
Mm.
And see the other options. First, you see in such type, you can see acute appendicitis. Isn't it? No. Why in acute appendicitis will you do a barium enema? No. Okay. So it's just a clinical diagnosis. So that is ruled out. Acute appendicitis is ruled out. Ulcerative colitis? Yes, no. Ulcerative
No.
colitis presentation is different.
Yeah.
Okay. So that is
Yeah,
ruled
it's
out.
not related.
Yeah. So carcinoma colon, ileocecal tuberculosis, two things. And low grade fever, we can't explain malignancy with fever. Weight loss we can explain.
Exactly.
But
Yeah.
low grade fever we can't explain. So it is ileocecal tuberculosis. Okay. There is a growth here. That's why the barium is surrounding the growth. Okay. That is a hyperplastic type of ileocecal TB. This is known as. Okay.
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 Yeah.